I'm on constant alert, anxious, hypervigilant. I read something on the amygdala being affected after concussion, which related to this fear. What's your opinion on it? How do I make it better? Well, there's a number of areas in your brain that can become affected following concussion. It doesn't necessarily mean that like your amygdala is affected because you're feeling anxious or nervous after a concussion. There's a lot of things that can make you feel anxious or nervous after a concussion, and that is a very common complaint following concussion. Um, I mean, it's probably one of the most common things that we see is that people tend to be very anxious, kind of on hyper alert. Sometimes they'll even feel nauseous because their stomach is always kind of turning with anxiety. That's a common response, but it also can cause a number of the other symptoms that we see in concussion. So people that are anxious tend to have more difficulty sleeping, and then if you have difficulty sleeping, you're going to have difficulty with, your next day. You're going to feel fatigued and foggy and all these other things. You might have headaches and all this stuff. So it kind of all tends to go in together. And also, if you're not sleeping properly and you have headaches, that can make you feel more anxious and all these things. So it becomes this snowball effect. It doesn't necessarily mean that a certain area of your brain is what's causing it, because it's usually a combination of different things, right? Mental health is a complex system. And so when you have these types of symptoms, the biggest thing is to try and find ways to get the anxiety under control. I frequently refer to mental health care professionals, psychologists, psychiatrists, sometimes even changing your diet. So some of the stuff I was talking about earlier, if you can lower that inflammatory load on your diet, sometimes that will make people feel much less anxious. It may improve your sleep, which then will reduce your anxiety. So again, everything is so interconnected that it's often by, like let's say your other symptoms are headaches. Well, if I can get rid of your headaches, you're probably going to feel less anxious to begin, and then you kind of start knocking things off the list as you go down. So to try and relate something like anxiety or being on constant alert to one particular area of, brain function, is not going to yield the answer you're looking for. What you really need to do is look at this from a global approach and say, okay, I have anxiety right now. How do I control my anxiety? Whether that's talk therapy, whether that's a short course of medication, whether or not that's mindfulness and meditation based, trying to be more in the present moment, whether that's controlling your other symptoms that may be contributing to your anxiety. So for example, maybe it's cognitively. Maybe you feel that you're falling behind on work or you're falling behind on school, and that's contributing to your anxiety. Well, maybe we can make some accommodations for you academically where we can get some of your assignments removed or pushed, which may reduce your anxiety. Do you know what I mean? So it's really patient dependent. So without knowing your case specifically, it would be hard for me to, pin it on any one thing, but just know that it is very interconnected, and there's a lot of things that are at play here that kind of assist in this. So find ways that you can reduce your anxiety, and a good place to start would be talking to your doctor, talking to your healthcare provider, and looking into maybe even something to start with talk therapy, and then try to do some self-help things like diet control and meditation.